How Dentists Can Remain Advisors of Merit to Their Patients, authored by Daniel L. Orr II. This article examines how members of the dental profession can sustain their long-standing reputation as trusted advisors amid declining public confidence in major institutions. Grounded in ethical principles, informed consent, and professional self-regulation, dentistry has historically ranked among the most trusted professions. The discussion explores challenges to credibility, including media scrutiny, concerns about anesthesia safety, controversial treatment hesitancy, and debates over community water fluoridation. Emphasizing the concept of the advisor of merit, the author argues that continued trust depends on truthful communication, transparency about risks, respect for patient autonomy, and freedom from conflicts of interest in clinical and public health advocacy. Introduction. Dentistry is fortunate to be perceived by the public as a trustworthy profession, in part by adhering to the American Dental Association Principles of Ethics and Code of Professional Conduct 1 and the American College of Dentists Ethics Handbook for Dentistry. For decades, dentists have been rated as a relatively well-trusted profession, including in Gallup polls, but such approbation cannot be taken for granted. Much of the trust in dentistry is secondary to how the profession has responded to distant and recent controversies in healthcare. For instance, in 1997, Reader's Digest published an article provocatively titled, "How Honest Are Dentists?" This work raised concerns by pointing out significant variations in treatment planning estimates from 50 different dentists nationwide for the same mystery patient, the investigator author. Estimates ranged from $500 to nearly $30,000. However, a later professional review determined that there has been no indication that the issue has caught on as a matter of public interest or concern. Admirably, the profession itself regularly discusses the dangers of opting for more convenient or expensive treatment plans that may not be optimal for patients. Additionally, sensationalistic media occasionally carry stories of deaths in dental offices, often peripheral to sedation or general anesthesia. Deaths in other facilities, such as hospitals, are more common, but because no one expects to die during a dental visit, such events are deemed newsworthy and profitable. In the 1950s, the first studies comparing mortality from general anesthesia in dental offices with that in hospital-based facilities demonstrated that careful patient selection and advanced training led to a much safer experience in dental offices than in hospitals. Those safe results, beginning with the office-based anesthesiology paradigm of Horace Wells in 1844, have continued to evolve and improve as regularly reported over the years. Anesthesiology itself has been peppered with controversy ever since Wells's monumental discovery. Historical controversies. Health professions have always been subject to confusing disputes. In 1950, doctors were featured in tobacco advertisements promoting different cigarette brands. By the late 1950s and early 1960s, clinicians prescribed thalidomide for morning sickness after it had been promoted in Europe as a safe sedative and antiemetic. The Rolling Stones recorded Mother's Little Helper in 1965, mocking the addiction to risk-free diazepam, promoted by physicians and seen in British housewives. Vioxx X, rofecoxib, was associated with tens of thousands of cardiovascular events, after which Merck agreed in 2007 to a $4.85 billion legal settlement. At the turn of the century, pain was promoted as the sixth vital sign, and doctors were encouraged to prescribe agents such as OxyContin with an addiction risk of less than 1%. Some practitioners were sued for underprescribing opiates. Today's laws restricting opioid prescriptions are so impractical that many doctors refuse to prescribe analgesics at all, turning patients to illegal sources, increasing addiction and overdose mortality. History shows that healthcare controversies can be confusing enough that even doctors have regularly made harmful decisions. Imagine the uncertainty for patients. Recently, previously reliable public advisors have come under fire, losing significant credibility with patients for allegedly failing to be circumspect or truthful. This group includes the mainstream media, saddled with a precipitous devolution in trust since 2020. COVID-19 sequelae. COVID-19 caused significant controversy in 2020 over whether to follow unproven COVID-19 treatment guidelines such as social distancing, masking, and injections of experimental formulations, all zealously recommended by experts, associations, and governments. Interestingly, one study found that dentistry, overall, was the health profession least likely to accept the formulations newly classified as vaccines, prompting the authors to issue a corrective call to action. The classical definition of a vaccine, an agent that bestows immunity to a specific disease, was described as problematic in Centers for Disease Control, CDC emails, obtained via the Freedom of Information Act in August 2021.20. Once the public noticed that the experimental formulations neither bestowed immunity to nor stopped the transmission of COVID-19, the CDC attempted to address that issue by changing the definition of vaccine on September 1, 2021, to simply an agent that stimulates the immune system, since the novel formulations did not perform as historical vaccines had. At the present time, the CDC states both that a vaccine is administered to induce immunity and prevent infectious diseases and their sequelae, but also that vaccination is the process of using a vaccine to stimulate the immune system to provide protection against a disease. These competing explanations seem to conflict with other CDC descriptions. It would not be surprising if current CDC guidance is more confusing than ever. Although data on the effectiveness of COVID-19 vaccinations exist, for example, Jung et al., the evidence is disparate and conflicting. Over 100 reports also document serious harm from the formulations themselves, as the experimental formulation studies continue to be analyzed. The discrepancies in data contribute to public confusion and mistrust. During the pandemic, the CDC, the pharmaceutical industry, other state and federal government agencies, and many health professionals opined that the new vaccines were safe and effective before any meaningful studies had been conducted, undermining public trust. Further, contrary to the principles of patient autonomy and informed consent, these early opinions were buttressed by the state's coercive power. None of these facts was lost on circumspect dentists and others who weighed the unknown risks and benefits. Dentists as advisors of merit. Dentistry appears to have weathered credibility storms despite what the public perceives as fecklessness, if not deceit, from other advisors. Polls show dentists remain positively competitive, still ranking above physicians and pharmacists, for instance. Historically, dentists are in a relatively trusted position as a cottage profession. Generations of families often claim the same trustworthy dentist, and they know her/his name. Dentists are generally perceived as advisors of merit, AOMs. AOMs include individuals who routinely put their advisees' interests above their own. An AOM must also relate the truth and, if not sure of the truth in any controversy, should admit to having an opinion rather than sure knowledge. Dentistry continues to recognize that patients must be allowed to decide, without coercion, whether to accept any advice offered, a basic tenet of informed consent. Finally, an AOM must be relatively unconflicted, that is, not seeking unreasonable power, which often equates to dollars at the expense of the advised. Dentistry's historical merit proven by means of fluoridation advocacy. Further buttressing dentistry's status, the profession has a claim to one of the greatest public health measures of the 20th century, community water fluoridation, which began in 1945. Most patients probably do not realize that dentistry's selfless support for fluoridation has cost the profession billions of dollars in restorative fees over the past 80 years, a fact never mentioned by Reader's Digest in 1997. Because of this selflessness, dentistry may be the least conflicted and most altruistic of the health professions. Fluoridation, coupled with Horace Wells' discovery of anesthesia in 1844, as acknowledged by the ADA, AMA, and other associations worldwide, has further warranted our patients' long-standing respect for the profession. However, the ADA and its dentists are aware that communities have recently begun removing fluoride from water supplies due to widespread concerns about potential toxicity from all sources. There are exponentially more unmeritorious advisors than any AOM cohort. The internet abounds with misinformation. The concerns about fluoridation and so many other matters are, in part, sequelae of unintentional or intentional distortion by legions of ubiquitous experts, promoting unproven opinions for or against various issues. It is no longer enough for dentists to advocate for anything by simply reporting positive findings. Our profession must now be able and willing to address potential negative commentary on various therapies. It is no longer realistic for dentists to convince patients with, "Trust me, I'm a doctor," after patients read about possibly real adverse effects. Fluoride itself can indeed be a harsh chemical and must be handled carefully when added to community water systems, as stressed by Tracy Boehmer, a national fluoridation engineer in the CDC's Division of Oral Health, in a 2021 presentation to the Missouri Coalition for Oral Health. The following was recommended when handling dry fluoride additives. If the acid comes in contact with skin, the affected parts should be immediately rinsed thoroughly for at least 15 minutes with water. Then apply 2.5% calcium gluconate gel liberally to areas suspected of fluorosilicic acid contact. Prompt medical attention should follow. Protective safety gear should be worn when handling fluorosilicic acid. The following protective clothing and equipment should be the minimum available. Gauntlet neoprene gloves. 12-inch minimum glove length. Full 8-inch face shield and chemical splash-proof safety goggles. Heavy-duty, acid-proof type neoprene aprons. Safety shower and eye wash in an easily accessible location. Approved, high-efficiency dust respirator, chemical mask, with a soft rubber face-to-mask seal and replaceable cartridges. Gauntlet neoprene gloves, 12-inch minimum glove length. Heavy-duty neoprene aprons, splash-proof goggles. Spills should be cleaned up immediately. Personnel should wash thoroughly after handling fluoride chemicals. In context, fluoride delivered from a shipping container is not equivalent to potable fluoridated water. Of course, too much of any chemical can be deadly, including oxygen. Dental anesthesiology residents commonly used the inhalational anesthetic methoxyflurane, penthrane, through the 1970s because of its pleasant odor and potent analgesic effects. However, methoxyflurane metabolism releases inorganic fluoride ions, which are associated with dose-dependent nephrotoxicity and occasional hepatotoxicity. Concerns regarding these toxicities ultimately led to its disappearance from routine anesthetic practice and withdrawal from the U.S. market by the Food and Drug Administration in 2005. The ADA is ready to help address concerns about fluoride in a living document, Fluoridation Facts, which contains an extensive review of pertinent FAQs the public may ask. The ADA is also prepared to research infrequently asked questions, as evidenced by its response to the author's query about methoxyflurane concerns. Fluoridation Facts helps dentists truthfully inform patients as they make fluoridation decisions. Conclusion. When a patient asks a question that the dentist is unsure how to answer, the dentist should not hesitate to state that they are still evaluating it. "I don't know yet" is not a cop-out or an admission of ignorance, but an honest declaration of commitment to further study. Such a self-imposed assignment is appreciated by prudent patients and others. Further, declaring neutrality is not risk-free amid intense political pressure when there is no definitive science on the issue. Dentists must remain vigilant in evidence-based practice. Dentistry must continue to uphold patients' right to accept or decline proposed treatments without coercion or fear of consequences, such as loss of employment, regulatory penalties, or civil or criminal liability. In 2025, the CDC reaffirmed the importance of patient autonomy and the legal doctrine of informed consent, a principle first recognized by the California Court of Appeals in 1957. Dentists remain relatively trusted now, but maintaining and enhancing that important status will require selfless, truthful, and unconflicted advisements in the future.